For silver diamine fluoride, in your tray you should have fluoride varnish, isolation materials, so we could use the garment clamp or the cotton roll holder, a dry angle. We have the SDF, the silver diamine fluoride right here. We have a micro brush, a disposable dish, we have a mirror, and we have Vaseline with the cotton tip applicator. So for silver diamine fluoride, the first step is to explain the procedure to the client. So let the client know that we're going to apply silver diamine fluoride on a tooth, and we're going to do this to arrest or to stop the cavity from growing. Then you're going to put the client in a supine position. Make sure the client has protective eyewear, and you're going to apply Vaseline to the lips and surrounding tissues to avoid any staining, because the silver diamine fluoride does stain the mucosa. So I'm going to put Vaseline all over the lips. You want to put it anywhere that you suspect that the silver diamine fluoride will touch, because it does stain. Once you apply Vaseline to the lips, then you're going to isolate the affected area with cotton roll and dry angle. I have a dry angle right here, so to apply the dry angle, the pointed end goes towards the back. The white part goes towards the mucosa, like so. We can use a cotton roll holder, and we're going to thread it in like so. Be careful that the lips don't get caught in. On the screen, you'll see a picture of the cotton roll holder. You can also flip the holder as shown and adjust it for the best view of the teeth you're working on. If you don't want to use the cotton roll holder, another option is to use the garment clamp, which you would thread in like so and clasp the chin like this so that it stays in place. Now what you're going to do is, once this area is isolated, you are going to dry the lesion, dry the cavity, dry the carious lesion like this. I'm going to apply SDF on the mandibular second premolar. So I'm going to dry the mandibular second premolar like this. Now I'm going to dispense 1 drop of the SDF into the disposable dish. So let's open up the SDF. Be really careful, because if it splashes, it will stain your clothes and it will stain your hands if you don't have gloves. It's really important that you're wearing gloves for this. So you could either pour it into the disposable dish. What I'm going to do is I'm just going to dip in here. So here's the micro brush. Feel free to bend it into a 45-degree angle so that you're able to get to the back more easily. Okay, so I'm going to take the SDF solution from this, and I'm going to apply it to the mandibular second premolar. For clinic, feel free to use water to simulate this activity. One drop actually treats 5 surfaces. So once you've applied the SDF to the lesion, allow it to soak in for 60 seconds or up to 3 minutes if your client is cooperative. Once the 60 seconds to 3 minutes have passed, then you're going to remove any excess with the cotton roll. So you're going to grab a cotton roll and remove any excess SDF. The next part is to cover the treated area with a thin layer of fluoride varnish. This will create a barrier and keep the silver in contact with the tooth. It will also give your patient a nice flavor rather than that metallic taste of SDF. Once that's done, you can remove all the isolation materials. If the dry angle is stuck to the client's cheek, what you can do is take some water, put some water over here so that it will loosen the dry angle so that you're able to remove this better. And that's it.